So we are starting with this topic of suppuration and abscess, and you know that abscess it is the abnormal cavity which contain the pus, and this sort of abnormal cavities which develop because of the ongoing infection, and as a result of the infection there is a production of the pus, and that pus get accumulated forming an abnormal cavity. So this condition is technically called as abscess. So there are different terminologies while we are dealing the cases of the abscess. So first, suppuration. So what is suppuration? So suppuration, in fact, it is the process of the pus formation. Whenever the part of the skin it get inflicted with the infection, and there is a fight between the pathogens and the body tissues, as well as the body defense system, and as a result there is a lot of casualties and killing in the form of the normal body tissues, as well as the casualties of the pathogenic organisms. So this whole process involved in which the pus is formed. So this process is called suppuration. Similarly, empyema, this is also very technical term which is used in most, in some cases or a few cases of the surgical conditions. So empyema, in fact, this is the collection of the pus in the normal cavity. Say you will, in your coming classes, you will study a condition which is called guttural pouch empyema. So if the pus that get accumulated within the guttural pouch, so that condition is would be termed as guttural pouch empyema. So if a pus that is accumulated in the normal body cavity, not in the abnormal cavity, so this condition is would be termed as empyema. Say the empyema of the frontal sinus. So frontal sinus, it is the normal, containing the normal body cavity, and if the sinus that contain the pus within it, so that pus that is coming from other side and it is being accumulated with that normal cavity, so that condition is called uh, empyema. So phlegmon, this is again another term which is also called as cellulitis. So this is the acute response in response to a highly irritant agent, whether that highly irritant agent is the microorganism or that is chemical, which is getting its entry, accidental entry into the skin, and the body is inducing a very strong response against that entry of the acute irritating object. So that response, that is called the cellulitis. So like if you have injected some irritant material into these muscles, like if you have injected some oil, TT oil, directly into the body, if you have injected some irritant antibiotics like oxytetracycline in case of equine, or injection of any long acting oily preparation into the body, sometimes it is inducing the very strong irritating response. So this condition, this inflammation that is resulted, so that would be termed as phlegmon or cellulitis. So abscess itself, this is the abnormal cavity containing the pus. So as a result of suppuration, as a result of that cellulitis, the pus is produced, and if this pus is being accumulated and forming an abnormal cavity in the body, so that would be termed as abscess. So these are the etiological factor which can result into abscessation or abscess formation. The number one cause is the microorganism or pyogenic microorganism, and as a result of the infection of these organisms, there is a chances of the production of the pus on the skin as well as the deeper part of the body. So there are certain parasites which can, if they remain and they are involving and they are getting penetration into the skin, they may result in certain chemical irritants like turpentine oil, if it is accidentally injected into the body, like tetracycline in case of equine, or any long-acting medicine that contain the oily preparations, that may lead to the process of strong irritation and strong body response, and ultimately it will result into abscess formation. So the clinical signs of the abscess, they are very much obvious, and they are represented with the 5 cardinal signs of the inflammation. So abscess is started with the response of inflammation. So you will be observed with the redness of the area because of high rush of blood, the heat, the area that will become more warm and heated, and you will see the swelling of the area because of the accumulation of certain vasoactive material, and you will see the abscess and So sorry for little interruption. So we are again reconnected with our discussion. So we were discussing the different signs and step numbers. So we discussed that the an abscess is presented with the uh, typical sign of the inflammation, that is the redness, heat, swelling, pain, and loss of function. So it may involve any kind of tissues, and usually the softer tissues, they are more excessively involved, and sometimes it can also involve the harder tissues. The major complication resulted in the cases of abscesses or abscess formation, that is the extension of the abscess. Whenever it is getting the side, and it will try to make its extension and involving the other neighboring tissues. So there is a chance that this is the most worst type of the complication, in which if we are not able to control the abscess at a site, so it can get extensive, and even it is involving the very soft or delicate and very vital organ of the tissue. So this abscess, which is starting from some part, it may involve the lungs, the liver, and other vital organs as well. So that's why whenever it is detected, it should be controlled and it should be treated as early as possible. So basically, we can, on the basis of the clinical sign and the nature of the abscess, we can classify and give types to the abscess as an acute abscess. So this is the abscess, which is also called as hot abscess. So by clinically, when you touch this abscess, it will feel more hotter because of the acute inflammatory response going on in this abscess. And this is still in a stage of immaturity, because there is a rapid response going on, and all the inflammatory factors, they are playing their role in the development of the inflammation. So acute abscess, in fact, this is the early rapid response of any bacterial or chemical response which has accidentally get its entry into the skin or other softer tissues. So the chronic abscess mean the older abscesses, or these are also termed as cold abscesses. And in the chronic abscesses, when the inflammatory process that is subsided, but still the remnants of the inflammation which are represented over the sides, like the microorganism entered into the skin, there was a defensive response of the body and the tissues, and as a result, that a fight between those tissues and the microorganisms. So many things were, many casualties were observed. So these remnants or casualties, if they are present and they are represented with a pus, so this sort of abscess, that would be called as chronic abscesses, or in which the response is very much delayed, and it may result into sometime the hardening of the tissues as well. So immature abscess, this is the stage of the abscess, which is the early stage, in which you cannot, just like the mango, if the mango that is very much harder, it is not ripe. But with the stages of time, with the passage of time, when it become more ripened and it looks more softer and delicious, and so same with the abscess. So in the early stages, the pus is very much hard and it is hard, but in the later stages, it becomes softer and cooler. So if this abscess that is very much hard and hot, in this stage of the abscess, that is called immature abscess. But when it becomes softer because of our certain medications, or because of the provision of the time we have left the abscess to get mature, so this sort of abscess that is not hotter, it is a little bit cooler, as well as very much softer. So this is called, so mature abscess. This is this stage of the abscess where we can easily drain the contents of the abscess, and we can surgically make the treatment of the abscess. So whenever we observe the cases of the abscess, we have to make a difference between the maturity and the immaturity of the abscess. If the abscess is very much mature, so this is a very good stage or time that we can drain the contents of the abscess, and we can make the surgical treatment. But in case of immature abscess, so first we have to wait for its conversion from immaturity to maturity, and then we would be giving our response as far as the surgical treatment is concerned. So the abscess may be superficial abscess if it is involving the superficial part of the skin or of the body, and it may be deeper abscess when it is involving the deeper tissues like the abscess present in the lungs, abscess present in the spleen, abscess present in the liver. So these are the deeper abscess. We cannot grossly appreciate those, are we cannot see grossly those abscesses. So these are called the deep abscesses. So we can have a differential diagnosis. So there are certain other conditions which can confuse you with this abscess. Like number one condition is cyst. So cyst, again, this is the abnormal cavity. This is the abnormal pocket which contain the fluid. But these sort of cavities, they contain the secretory lining within it, and those secretory lining, they are producing the fluid, and ultimately that fluid that is being produced and that is accumulated. So this condition is called cyst. So if you aspirate the contents of the cyst, so they will be yielded with a yellow or watery like fluid. So this condition can be differentiated from the cyst. And similarly, this condition can also be differentiated from hematoma. Again, hematoma, this is the abnormal cavity which contains the blood. So after aspiration, if you yield it with a blood, then you can say that this is not the case of the abscess, but this is the case of the hematoma. But after aspiration, if you get pus within your syringe, then definitely you will be giving that condition, or saying that this condition, this case is the case of the abscess. Similarly, herniation, superficial herniation is also the condition which is presented with a swelling on the body and cavity on the body. So on needle aspiration, if you are yielded with nothing and your syringe remain empty, and then this condition may also be termed as that this is the case of this is not the case of the abscess, or this is the case of something else. So hernia, they are also the condition, they will be discussed in your later classes, that in which you are represented with certain clinical sign of the hernia, like there will be the hernial ring formation, there will be hernial contents. So on the basis of those clinical signs, you make the difference that this is the case of the hernia or this is not the case of the abscess. So coming to the treatment of the abscess, if you find the abscess, this is not the stage of maturity, then you can apply certain substances which can turn the immature abscess into mature abscess, like the use of hot water. They can also break the fibers in the abscess and ultimately turn it into a softer. Similarly, use of certain contents like iodix, the massage, it can also gradually turn the abscess from its stage of immaturity to similarly equivalent poultice. This is a very commonly practiced in our clinical hospital, and these poultices, these are applied on the immature abscesses, and ultimately after a period of 6 to 7 days, you will see that the hard abscess, the hot abscess, the hard contents of the abscess, now they are turned to softer stage, and the abscess that has been converted from immature stage to the mature stage, in which there is a softening of the tissues, the contents, they are softer, the pus that can be observed within the cavity in a fluid form or semi solid form. So this is the time where we can extend our clinical intervention to drain the contents of the abscess or make it. Similarly, some weaker contents of the mercury blisters, they can also be used just to convert the immature abscess into mature abscess. So the surgical method of how you surgical drain the abscess. So the dependable part mean there is a point of maturity. Say this is the abscess. This is the abscess, and in the center you will see a point of maturation. Whenever this abscess it get matured, so this is the point of maturation is the area where you find the skin that is more thinner, and in even a very small jerk or even a very small force of your incision, you can rupture this thin layer of the skin over that side. So this is called point of maturation. In fact, this is a good guideline for you just to drain the mature abscess. So you can start from this point of maturity, even if the abscess is very much extensive. So you can increase the level or increase the size of your incision, so that you will be well able to drain out the contents of the abscess. So incision is given nearly at the point of maturity, and the contents, they are drained, and the remaining cavity, that is lavishly washed with some washing agents, like in the cases of basic principle of open wound treatment. Like we can use the normal saline solution for washing. We can use the uh, mild solution of the tincture iodine. We can use the solution of iodine just to wash out, just to completely wash the inside of the cavity. And similarly, the second technique, that is called seatoning. This is a very important technique which is used in the cases of large animal practice. So if the abscess that is lying at the non-gravitational area of the body, say there is a uh, say in case of say this is the donkey, and this is the abdominal cavity, and this is the thoracic cavity, and this one is the abdominal cavity. So at the most dorsal part, in the just at the level of the uh, at the level of the lumbar or behind the lumbar region, so you have presented with an abscess. So this is the location of the abscess, where you cannot directly drain the abscess because the location is against the gravity. And if we give the incision over that side, say this is the point of maturation, if we give the incision over, so we cannot automatically remove the contents. So in these cases, we have to create two openings. One opening at the most proximal part of the abscess at the point of maturation, and one opening at the most lateral aspect of the abscess, like here. Okay. So these openings, they are joined with each other. So this opening is called counter opening. Counter opening. So after the drainage of the contents, so in the next step, what we do, we will take a long piece of gauze, and that gauze would be soaked with some antiseptic solution. So this gauze is inserted from this opening, and that is opened, or that is taken out from this counter opening. So this gauze is fixed in outside. So यहाँ पे हमने इसको इस तरह आपस में मिला दिया. So this gauze has to play two important roles. Number one role, because it is soaked with some antiseptic solution, so it will provide a continuous supply of antiseptic agent within the abscess or within the cavity that is still containing microorganism, right? And the second step would be, it will keep both the opening, either the opening at its point of maturity and the counter opening, both the openings. So it will keep both the opening open or patent. So this is the requirement at that stage, because we want both the opening of the abscess to remain open, so that the content, they should automatically be released. Whenever they are produced, they should be automatically be drained. So this sort of practice, in which we create a counter opening in the abscess, So it is a very good debriding agent, and it will cause the removal of the contents, necrotic material within the lining of the abnormal cavity. We can also make use of antiseptic agent like hydrogen peroxide. So this is the agent which can make its interaction with the contents and would release the nascent oxygen. And if any sort of chances of any sort of anaerobic bacteria within the abscess cavity, so it can cause killing effect, it can cause damage to those bacteria. So we can also make the washing of the cavity with the light solution of potassium permanganate. This is also the oxidizing, very good oxidizing agent. The other condition which involving the integumentary system and the skin, that is the cyst, and I have already given you the introduction or definition of the cyst. That here in this case you can see this is the abnormal cavity which is containing some fluid, and that cavity lying within the oral cavity. So this is an abnormal sac which contain liquid or semi-solid substances. And the most important characteristics of the cyst, that the sac is represented with some secretory lining within it, and that secretory membrane that is responsible for production of the fluid, and that fluid is produced within the sac and that get accumulated, forming resulting into an abnormal cavity. So this is called cyst. And this cyst may contain solid agents, semi-solid agents like tooth and hairs, and it may contain the fluids. So there are four types of the cyst. One type is called retention cyst. So this cyst is because of the accumulation of duct and glands, like the salivary cyst. You have gone through the case of the salivary mucocele. If the salivary gland duct that is occluded and that is obstructed, so there is a production of the saliva within the salivary gland, and that saliva will get accumulated within the salivary gland, and it will result into cyst formation. Similarly, if the obstruction is in the duct and the remaining part of the duct that is not obstructed, that will become more extended and dilated, and that will result into the form of, like in the cases of the ranula. In fact, this is the not this salivary gland. In fact, this is the salivary duct, and that has to be come out into the oral cavity for release of the saliva from the cervical or sublingual salivary glands. So there is an obstruction to this duct, and you can see the pooling of the duct saliva within the duct, and it has result into dilatation or dilation of the duct, and that duct now has take the shape of the cyst. So this sort of cyst, in which there is a retention of the liquid material within the duct because of the obstruction of the duct, so that is called retention cyst. So salivary cyst or ranula, so this is the one of the example of the retention cyst. Another type of the cyst that is called exudation cyst. Like in horses, you can see this condition, hydrocele. This is the abnormal accumulation of the fluid within the testes. Say the testes, they are say uh, say this is the just like these are the testes, and we have there are certain layers. If you go through the anatomy of the testes, say they are encapsulated with the scrotum, and beneath the scrotum there are 2 to 3 layers, like tunica dartus, tunica vaginalis. Say this is the tunica vaginalis, and this is the tunica dartus. And if there is a accumulation of the fluid, if there is a accumulation of the fluid, like the fluid that is being accumulated within these cavities, so this condition is termed as a hydrocele. And This is one of the example of the cyst, and that cyst is called exudation cyst, in which the fluid that is in the form of the exudation, it get accumulated within the layers of the some organ, and ultimately it has resulted into the hydrocele formation or cyst formation. There is another example of the cyst that is called congenital cyst, as the name showing that those cysts which are resulted because of the embryonic defect, also that is called congenital cyst. So the example is urethral cyst. So we will also be going to have the detail of this condition, urethral cyst. So urethral cyst is the cyst. It is uh, because of the accumulation of the fluid, or because of the accumulation of the urine within the duct, which is called urethral duct. In fact, this duct is responsible for the excretion of the urine during the fetal life through the umbilicus. So this is called, so after the birth of the baby, so this urethral duct is closed. Naturally, it is closed after the birth of the baby. But in some cases, so this urethral duct is not closed, it remained open in the body, and until unless it get closed at the point of umbilicus. So the duct is patent still within the abdominal cavity. So the urine, it will go from the bladder, it will go into the duct. So that duct will become extended. So this sort of cyst that will develop within the duct, so that is called congenital duct, and it is because of the congenital defect that uricus that remained patent, and it has turned into a cyst formation. Similarly, there are certain other cysts like dermoid cyst and dentigerous cyst. In case of dermoid cyst, here you can see in this picture some other hair forming tissues. Now they have been mistakenly been placed within the eye, and ultimately within the eye you will see the growth of the hair. So the cyst that is represented with other growth of the tissues, so that is called the dermoid cyst. And dentigerous cyst, in which the tissues of the temporal region, they are mistakenly being implanted in some other part of the, say, the tissues in the fetal life that are responsible for the development of teeth. If they mistakenly be displaced or misplaced in the ear region, so definitely you will see the cyst which contain the teeth within it in the ear region, auricular region. So these sort of cysts, they will be called as dentigerous cyst. The cyst which is contained with some teeth within it, so these are called dentigerous cysts. So this is also the example of the cysts which are due to misplace some embryonic tissues into the abnormal area. So this is the misplacement of some skin or hair forming tissues in the eyes. So this is the misplacement of some teeth tissues in the auricular region. So they are resulting into dermoid cyst and dentigerous cyst. So the cysts, they can easily be diagnosed on the basis of this clinical test, which is called aspiration of the cavity, or aspiration test. So you will take a sterile syringe, and that abnormal sac that is inserted with this syringe, and the fluid within the sac that is aspirated. If the fluid that is a straw color, or it is just clear cut fluid, then you will declaring that thing, that swelling or sac as a cyst, because it would never be abscess, because if the content they contain the pus, then you can declare the case of the abscess. But if it contain the just like a sterile fluid, then you can declare this as a case of cyst. So just like the cases of the abscess or hematoma, you would be treating the cases of the sac as an open treatment. Like first you have to puncture the cyst, you would drain the fluid, and also would like to destroy the inner lining of the cyst, which are secretory in nature. If you are not able to destroy those inner lining, so you will see the recurrence of the condition, because those secretory linings are present. They will definitely be secreting their fluid, and the re-emergence of this cyst that at that part, that will be noticed again. So that's why these are the three basic steps involving, that is the puncturing of the cyst, removal of the content, and the burning or evacuation or the removal of the secretory lining of the. So for this purpose, we have to, after the drainage of the content, we will insert or inject tincture iodine, and this chemical, it is quite irritant and it will destroy the secretory membrane. Similarly, we can also take this opportunity of, we can also take this option of seating. We can, if the, depending upon the position of the cyst, depending upon the size of the cyst, so we can also have a counter opening at the site, at the lateral aspect of the abnormal sac, and we can place we can place the gauze that is soaked with the antiseptic solution, and this type of clinical practice, that is called seating. And so in case of dentigerous cyst, where you have observed the presence of teeth-like tissues within the cyst, so those hard masses, the teeth, they are present in the cyst, they are removed surgically. The lining that is opened, and the contents, they are removed, and ultimately the the cavity that is closed. In case of brachial cyst or honey cyst, whole the cyst that is excised and the material that is removed, and the remaining edges of the skin, they are approximated with each other. The other type of the condition that involves the, so I would take 4 minutes, that is the ulcer. So we have already discussed this condition. Ulcer is the wound that is not showing the tendency of the healing. So if there is a repeated application of the causative agent over the site, so this wound that is not showing the good tendency of the healing, in mean the granulation mass and the epithelialization. So ulcer can be observed uh, on the skin, as well as involving the mucous membrane, like the epithelium, as well as the mucous membrane of some organ, like in case of stomach ulcers and duodenal ulcer, if the mucous membrane of these softer tissues, if they are involved. So in case of ulcer, the healing process is very much slow, and the ulcers, they can be classified depending upon the position of the ulcers, depending upon the response of the ulcers. Like they may be traumatic ulcer, if the ulcers, they are being developed because of any trauma. They may be decubitus ulcer if the ulcer, they have been resulted with the continued body pressure. Say in case of uh, in the cases of the hypocalcemia, when there is a paresis or paralysis of the hind quarter of the body, that is the animal, cattle and buffalo, cattle especially, they are not able to stand up, they rise up in the body. So definitely, because of the continued pressure of the body within the ground surface, so it can produce the ulceration of the skin. So these are of ulcers which are resulted due to continued pressure. So these are called decubitus ulcers. So pyogenic ulcers, if the ulcers, they are further complicated with the involvement of certain microorganism and resulting into pus formation, so those ulcers, they are called pyogenic ulcers. Burn ulcers, if the cause is burning, maybe chemical burn, maybe some heat agent that has resulted into ulcerative changes in the skin, so that is called. So healing ulcers are those ulcers whose edges, they are showing the tendency of the healing. So you are represented with the granulation mass, so those are called healing ulcers. The weak ulcers are those in which the granulation mass is there, but you are not presented with the epithelialization of the edges. So those are called weak ulcers. And indurated ulcers are those ulcers in which the edges, they become very much harder and indurated. So and there are certain ulcers in which there is an involvement of some mineralizations, and the minerals, they get deposits within the ulcer. So these are called the callus ulcers. So the treatment is just keeping in view the basic principle of the open wound therapy. So first we would have to remove the cause, and we have to make a lavish warm antiseptic irrigation of the ulcers, and then we have to offer the very good antiseptic dressings like the use of bismuth subnitros, iodine, paraffin paste with a ratio of 1, 2, 3, 4. So these are the this is the combination of few things like bismuth subnitros. It is a hygroscopic agent and antiseptic agent. Iodoform is a very good antiseptic agent, and the paraffin paste. So this pasty material that is applied on the wound, on the ulcerative wounds, and it will promote the healing. Similarly, caustics or burning agents are applied on those ulcers which are very much older, just to refresh the ulcerative area and just to remove the superficial lining of the older tissues, so that the wound become fresh, and ultimately there are good chances of the healing. Similarly, in certain cases where you can see the huge proliferation of the granulating mass or callus formation, so these cases, they are treated with your surgical excision. The extra growth that is removed surgically, the wound that is made fresh, and ultimately it is put on the track so that it can re-emerge with its healing tendency. So thank you very much.